Hi, everyone. I'm Dr. Lisa Palmer, joining you tonight on the topic of dizzy, dehydrated, and dumbfounded. Dizzy, dehydrated, and dumbfounded. It all happened. Well, it happened at multiple starting points, but the time that I remember the most was I was in my bedroom, laying in bed, and the whole entire room was spinning and spinning and spinning. No, there was no alcohol involved. At least I would have had a reason for the dizziness, but I was so dizzy it felt like the whole room was spinning. I don't know if you ever had gone in on those carnival rides. And I remember as a kid there was one called the Gravitron, and it would spin really quick, and then you'd like get stuck against the wall. Well, I felt like I was spinning, and the room was spinning, and it was horrible. I couldn't sit up. If I had to walk, I had to hold on to someone because it felt like the earth was moving. It was just pretty miserable. And some people can get dizzy like that. So I was asked, Dr. Palmer, when people get dizzy, what are the causes? So you could have dizziness starting with the top. You could have dizziness with problems in the inner ear, right? So problems in the ear, one ear or both, ear infections, inner ear infections can make people dizzy. Sinus infections. So some people will get a sinus infection on one side, or they have an infected tooth causing a sinus infection. And the pressure from that can cause dizziness. It could be dehydration, right? So didn't drink enough fluids, electrolyte imbalances can cause dizziness. It could be low blood sugar or low blood pressure. So low blood sugar, someone needs to eat food, their blood sugar goes down, that can make someone dizzy. Low blood pressure. So some people are on blood pressure medications, and the blood pressure medication sometimes can be too high of a dose. The blood pressure goes down too low, and they can feel dizzy from that. There are glands in the back of, on top of the kidneys called adrenal glands. And if those adrenal glands have been working overtime because you have stress at your house, you have stress at work, you have stress with your significant other, you have stress with your family, life is stressful, you watch all those really intense shows that are stressful, you might have back pain. Back pain might have nothing to do with your back and everything to do with the adrenal glands. And those adrenal glands located above the kidneys, so if you touch your lower back, they're above the kidneys, they secrete stress hormone. And when you have chronic stress, they can start not to work so good. And so that can present as low back pain. That can present as dizziness, right? You go to pick up something off the floor, you drop a pen on the floor and you go to pick it up and you're like, whoa. Or you pick a sock up off the floor, or a dog toy or whatever, and you get up and you're like, whoa. That could be because the adrenals are compromised. The adrenals are supposed to raise your blood pressure. So when you go from sitting to standing, or you go from lying down to sitting, or lying down to standing, or bent over to standing, that your blood pressure increases, so then you don't get dizzy. For me, though, it dumbfounded a lot of people on why I was dizzy. I had chiropractors take a look. I went to an urgent care center and they took a look. They thought I needed a vacation, which sounded great, but I was too dizzy to do that. And it really wasn't until the cause of my problem was found through nutrition response testing that I had a heavy metal toxicity in my pituitary gland. And so that heavy metal was mercury, and the mercury made me dizzy. The mercury caused my hair to fall out. Like I'd brush my hair and it fall out in clumps. The mercury negatively affected my immune system because toxins negatively affect the immune systems, and I had a lot of parasites. Which caused me to look bloated, like I was pregnant, to have irregular periods, to be exhausted all the time. And so it wasn't until nutrition that was applied found out that there was mercury negatively affecting my pituitary gland. Now, this did not require surgery to like shove something up my nose and pull out my pituitary gland, but rather detox gently, not pooping and puking, detox gently the mercury from my system using whole food supplements. There's an amazing company called Standard Process, and they make a product called parotid PMG. So taking parotid PMG and a specific supplement to support the gland in my brain called the pituitary gland fixed the cause of my problems. Now, Standard process doesn't treat anything. It more so rebalances the body with whole food nutrition, with nutrition that can repair glands, that can repair organs, that can get the body functioning properly again. I think in America and around the world, a lot of times people look for solutions, which I don't even think they're solutions, but they look for solutions that will suppress the symptom, right? So if they're dizzy, they want something to take the dizziness away. If they have a headache, they want something to take the headache away. If they have high blood pressure, they want something to lower the blood pressure, right? Like they're looking to suppress the symptom. The pain in their ankle, they want something to take the pain away, but they're not looking for the cause. And so, with what we do at our office, Palmer Natural Health, is we do a specific technology called quantum nutrition testing. And that enables us to find what is balanced in the body and what is not balanced in the body. If something is not balanced in the body, it may be creating a symptom in you. It may be creating a symptom in you that is dizziness. It may be creating a symptom in you that is fatigue. You're tired. You don't want to wake up. You don't want to drop the kids off at school. You don't want to go to work. You don't want to do anything extra. You don't want to cook dinner. You want to call Uber Eats for food. You don't want to do the laundry. You don't want to do anything. You just want to lay on the couch and binge watch a show because that's all you have energy to do. Doesn't mean you're a lazy person. It means there's a cause to your fatigue. And so with quantum nutrition testing, we look for what is balanced. That is good. We look for what is not balanced, and we look for the cause. Perhaps you got exposed to a chemical like chlorine, and that caused imbalances in your body. I think we all can relate to someone, poured bleach somewhere. Maybe you went to a public bathroom and someone poured some bleach and you get like a headache, right? That's a physical effect from a chemical, from a toxin. You didn't go say, give me the anti-headache bleach, anti-bleach, right? You said, oh, well, someone poured some bleach in here, so I'm going to get out of this environment. But what did the toxin do to your physiology? The thyroid does not like bleach at all, right? So those of you that are bleaching things and you're touching things with your bare skin, right? Maybe you're using bleach wipes or wipey like counter wipes that have bleach in it. If you're touching that wipe with your hand, you're absorbing some of that bleach. What does that do to the thyroid gland? Well, that can imbalance the thyroid gland. What does that look like? That can look like fatigue. That can look like hair loss or baldness. That can look like premenstrual syndrome. That can look like gaining of weight because toxins are stored in fat tissue. And so back to my story, I was dizzy. I was not dehydrated. And I dumbfounded, the doctors, they weren't sure what to do, but then um, uh, practitioners were amazed at the results because once you find the cause, which in my case was a mercury toxicity, and you handle the cause in a way that the body can naturally detox, then the dizziness went away. It was great. The bad symptoms of fatigue, the irregular periods that I experienced, the 50 extra pounds that I had. I was exercising. I was playing soccer. I was lifting weights, and it seemed like the more I exercised, the fatter I got. To the point where I was a strength coach, right? My background is sports medicine. I did additional training in strength and conditioning, which is personal training. I did additional education in sports chiropractic and athletic training and so on. And I knew what I needed to do to work out. So I hired a personal trainer. And the personal trainer was running me through these heavy workouts. I was sprinting on the treadmill. I was lifting weights. He was killing me. And as a former professional athlete, I loved working out at a high level. But the harder he pushed me in the gym, the fatter I got. And looking back, knowing what I know is, well, it wasn't from lack of exercise on why my body was fluffy. It wasn't from lack of exercise that I was gaining weight. It wasn't from lack of exercise that I was having these issues with dizziness. The dizziness actually was worse with exercise, which is not a good combination, by the way. It was that I had a toxin in my system, and that if your body's so smart, so if this is the mercury, your body will put the mercury or the chlorine, the chemical, the heavy metal, whatever it is, in fat tissue. So I was doing all this exercise to try to get my body to lose weight, but my body was like, what are you doing, dummy? Like, we're protecting you from the mercury. And then it took the exact right supplementation based on what my body need. This may not work for you based on what my body need. For my body to say, okay, you don't need to hold on to that mercury anymore. We can process this out naturally in the bowel. And 50 pounds melted off my frame without exercise, because I was too tired to exercise at that point. And so if you need help locating the cause of your problem, if you're tired of being tired, if you're tired of being fluffy, if your pants are tight on you, if you have conditions that are not optimal, then call us at Palmer Natural Health. We would be happy to send you paperwork. We would do a consultation with you in the office or on telehealth, get your health history, your family history, your surgical history, really talk to you about what your health concerns are and your goals, apply the quantum nutrition testing to that information, figure out what we can do to make you a personalized program to rebalance out your body, coach you along the way with lifestyle, coach you along the way with help. And we see amazing results in people where their energy's improved. They're at what they consider their ideal weight, not what I consider their ideal weight, what they consider their ideal weight. Their premenstrual syndrome symptoms have gone away. They report they don't have hot flashes anymore. They report they're happy, they're more productive. We've even had patients that get raises, and they get raises at their job because they're in a better mood. They produce more work. They're better with their colleagues. Their bosses notice and they're getting raises. So if we can help you out, message me in the chat that you want help. You can put the word, don't put help because that'll freak me out. Put in the word dizzy, put in the word, tell me what's happening, or call the office at 407-682-8444 during normal working hours, and we'd be happy to help you. I'm Dr. Lisa Palmer on the topic of dizzy, dehydrated, and dumbfounded. You too can get amazing results, and I'd be happy to help you.